Hi guys, my name is Michelle, and I'm going to be discussing preoperative skin cleansing with chlorhexidine gluconate and how it relates to surgical site infections. Two abbreviations I use throughout this presentation are CHG, chlorhexidine gluconate, and SSIs, which are surgical site infections. Surprisingly, surgical site infections still continue to be a problem today in healthcare. According to a study that I found in Grawling and Vastley and from 2013, they said that 500,000 patients still contract an SSI in the United States every year, which is crazy. These infections account for increased morbidity, length of hospitalization, and cost of care, which are all very current issues in healthcare today. I decided to research this topic due to the frequency of SSIs in patients that I've seen in my practice, which are all C-section patients that would be contracting an SSI for me. The purpose of this presentation is to provide information about different trials that were done to determine the effectiveness of CHG in preventing SSIs in various surgical procedures. The research style question I used was a PICO question. In PICO, the P stands for patient, the I stands for intervention, C is comparison, and O is outcome. So for me, the patient population I looked at was any patient undergoing a surgical procedure. The intervention was for all surgical patients to cleanse their skin with CHG prior to surgery. Comparison would be to compare CHG to other preoperative skin cleansers, and the outcome would be cleansing the skin with CHG prior to the surgery will lead to fewer incidences of SSIs. In order to find the articles that I used for this project, I searched two databases, CINAHL and Academic Search Premier. Both of these databases are available through the college's library site. On the databases, I made sure to filter my results by date so that I got nothing older than 5 years. I also wanted peer-reviewed journals and full-text options. When I was searching, the key terms that I used were chlorhexidine gluconate. I did find the research project a little bit challenging because a lot of the results that I found were meta-analysis, which were not acceptable for this project. I did finally find some articles that were good. I chose these articles due to meeting the criteria of being the research studies that we were looking for, and also because they all evaluated the effectiveness of CHG, which directly related to my research question. When I conducted my literature synthesis, I looked at the similarities and the differences between the studies. So some similarities that the studies had were all of the studies used a quantitative design. They were all randomized trials. 4 of the 5 studies proved that CHG was effective at reducing surgical sites when used prior to surgery, and only 1 of them found that it was not, and they were only studying one type of surgical procedure. All of the trials evaluated the effectiveness of CHG as a preoperative skin cleanser. So some of the differences I found was Edmondson in 2015. They monitored the concentration of CHG that was found on a patient's skin prior to surgery, as well as the rate of SSIs. They determined that a patient should cleanse with CHG 2 times prior to surgery and allow the CHG to sit on their skin for at least a minute prior to rinsing it off for each of these cleansing times. Grawling and Vastley based their research on patients who completed a 2% CHG cleanse prior to surgery and those who did not. Capita, Imala, and Mont from 2016 used CHG impregnated cloths compared to the hospital's current cleansing protocol, which they did not tell us what that cleansing protocol was. Cervantes in 2015 compared CHG and bovine iodine. Prava 2017 found that patients who were undergoing a ventral hernia repair had an increased risk of surgical site infections when they preoperatively bathed with CHG, which was the only research article that I found that did not say that CHG was effective. According to Prava et al., 2017, there is varying evidence about the use of preoperative chlorhexidine gluconate to decrease surgical site infection for elective surgeries. This intervention has never been studied in ventral hernia repair, the most common general surgery procedure in the U.S. The ventral hernia repair is the kind of surgery that Prava used to create their study. So when I approached my synthesis, I wanted to look at the similarities and the differences. I highlighted each of those. I evaluated the results, I evaluated the purposes of each study, also the design and methods that were used throughout each study. My thoughts after my synthesis were that CHG should be trialed for the effectiveness prior to implementing it as the standard for all preoperative cleansing protocols, and CHG bathing has been shown to be effective in many different types of surgical procedures. However, it's not an effective solution to all procedures. My recommendation for practice and management would be that a change should be made. I think that CHG is an effective pre-surgical cleanser for a lot of surgeries, and it should be implemented in those surgeries. However, I do think that it would be appropriate for people to evaluate the effectiveness for the CHG for all kinds of surgical procedures before they would implement it. I think it would be a good idea to consider having CHG as scrubs available in the OR for more emergent cases when patients don't have the opportunity to do the scrubs at home prior to coming in. Hospitals and doctors' offices should also provide the CHG solution for patients to use to cleanse their skin prior to the elective, scheduled, or non-emergent surgeries. Some barriers to this would be the cost of CHG compared to the cost of other cleansers, patient compliance, patient allergies, and the effectiveness of patients' independent bathing. Another big barrier would be that the procedure has not been evaluated for every preoperative cleansing that needs to be done. So all surgeries have not been tested yet, and I think that they should be tested prior to saying that, okay, we need to use CHG for everybody. So my conclusions and key points are that CHG is an effective skin cleanser for many types of surgical procedures, but not all. CHG has been proven to be more effective when patients use it more than one time prior to surgery. The study from Edmondson found that patients had the greatest concentration of CHG on their skin surface prior to surgery when they showered at least 2 times with CHG and used 4% CHG solution both times. And during their shower, they had to allow the solution to stay on their skin for at least a minute before they rinsed it off. In order for CHG to be effective, patients need to receive effective education prior to completing their skin cleansing. So for example, if they're not told, hey, you need to leave this on your skin for a minute before you rinse it off, their concentration is not going to be as good as another patient's. So some takeaways that I want you to think about is consider adding CHG solution to the skin cleansing protocol for patients who are planning to have surgery in your facility. And what is the current preoperative skin cleansing protocol in the facility where you work? Depending on what kind of patients you deal with every day, you guys might already be using CHG solution, and it might be working for you or it might not. And then this is the list of references and the 5 studies that I used throughout this presentation. Thanks for listening.